One thing we've done, which is a bit new for us, is we've actually created a marketing position and a communications position within the system, not only to report on how we're doing, but to draw in the best learnings of other places. So I think that's a unique contribution for us. The other is marrying our research agenda to this initiative and saying, how might we shift some of our research foci to ask questions across the continuum, as opposed to saying, I'm going to just look at my little piece of where I work, and how could we bring together like research teams, so I'll just go back to my head and neck example, while we may be doing research on a head and neck oncology patient historically for the surgical piece. Could we, or how might we expand that research question to say, what about the home-based piece? What about the visiting nursing piece? So can we frame that question? Recognizing that, you know, investigator independence is important, but trying to reframe some of the discussion, try to reframe some of the opportunity. And then, of course, the last piece is working closely with government to demonstrate, here's what we've learned, good and bad, out of our system experiment. Here's some things that we think might be exportable. And here's some things we tried that, frankly, didn't work as well as we'd hoped. We haven't hit the tried and didn't work as well as we'd hoped yet.
It's still early.
But I have a feeling we'll find many of those. And for most of us, you'll learn more from your errors than your wins. So I don't think, well, I'm certainly not going to look at, well, we tried that and it didn't work as a failure. If we learn something and we can export that to others for knowledge, then we've contributed something as an academic network.